Every Tuesday and Thursday for the past several months, we've been joined live with an infectious disease doctor, bringing you the latest updates and answering your questions on the ever-changing information with the COVID-19 pandemic.
So once again this morning, we're glad to be joined live by Dr. Dana Hawkinson from the University of Kansas Health System. Doctor, as always, good morning. Thank you for being with us this morning.
Hi.
So local school districts are starting to think their reopening plans and try and get these figured out, considering the rise in cases again. You're doing this all morning long on those 8 o'clock calls where you're letting people know about different things going on with school systems and decisions that need to be made. What are you telling people right now, or what do school districts need to keep in mind as they start to rewrite these plans?
Yeah, you know, when it first started with the discussion about restarting schools, because we feel it's healthy for kids to do that, that was a few weeks ago. Certainly things have changed, as we've seen in COVID time and time again. Things continue to evolve weekly, daily. We're still trying to keep track of the cases, the amount of spread throughout the community, try and find ways to make it the safest for kids and teachers and other support staff to return to school if that's feasible in that school or in that school district. It's a very difficult topic, and there are a lot of details involved in that. You know, the best thing is to try and keep everybody safe. And so hopefully moving forward, the administrators within that school district and school can determine the level of risk. But certainly as we see more and more cases, these topics will become more and more relevant to discuss on a daily basis until that time comes to make that decision, should students return to school or not.
Dr. Hawkinson, we've heard several instances locally of people waiting days to get a COVID-19 test back. And scientists in Finland created a test. Works like a breathalyzer, essentially. We were talking about this in the break. It uses nanosensors to detect different gases from the lungs they say correspond with positive COVID patients. The most striking part about this is this test result comes back in 2 minutes. So what are your thoughts on this kind of test? Could this be as accurate as a swab? Could we see this in the near future?
You know, I hope. We are always looking for better test capacity and more testing to help identify those cases of where we don't know that people are ill. So this sounds like it could be promising. Certainly it was put out in Finland. I think they want to expand their trials here in the United States soon. It looks like it's not really testing for the virus itself, but other biomarkers, as you alluded to, biomarkers that you expel in your gases when you exhale. So if it proves to be an accurate and somewhat even sensitive test that can be done very cheaply and very minimally invasive to the patient, I think that's good. You know, maybe one of the silver linings that we're seeing from this COVID pandemic is just the innovation that's occurring, the innovation that's occurring quickly with vaccines, the innovation that's occurring quickly with diagnostics and therapeutics, as we're seeing. So hopefully it proves to be positive. I think there's such little information about it now. We need to continue to wait and see what they publish and their data and all that.
Doctor, you mentioned vaccines there. We're all waiting for the day where we hear the news. Here it is. We have a vaccine. I think most of us are lucky enough to have not lived in a time where we didn't have a vaccine to something and we had to wait until that came out like this now. What are we going to do here whenever it comes out? How do we know we can trust this whenever it's time? Yes, this is the one. Because so many different agencies are working one, are we going to have choices whenever that happens? Not necessarily timeline here, but when are we going to know this is one we can trust?
Yeah, I think that's good. So a couple months ago, the company that originally published a week ago or so in the New England Journal of Medicine put out their initial press release. Now we have the actual publications, the New England Journal of Medicine, and the other vaccines that you alluded to were published in the Lancet. So the first thing, obviously, because we know there is a lot of consternation and debate about getting vaccination. So vaccination so far, and what we have, has proven to be very safe. So we want to make sure it's safe. These vaccines and the published data on these vaccines right now appear to be safe, and that's the most important thing. The next thing is efficacy. So far from these early published studies, they look like they are efficacious. What are we looking at in the future? I don't think we know. I think we anticipate needing 1 or 2 or maybe even 3 different vaccines, but at least starting with one, and then every year probably needing a booster similar to what the flu is, although it's not a a booster for influenza vaccine yearly. It's just your yearly influenza vaccine. But we may be looking at needing boosters maybe 1 or 2 times throughout the year. We may be looking at needing 2 or 3 different vaccines. We don't know yet. We are still in the very early stages. But these early stages, as far as safety goes, look very good.
Well, that is welcome news.
Yeah.
Dr. Hawkinson, thank you very much. We'll be right back.